Hello and welcome. My name is Paige Burgess, and I'm the Community Engagement Coordinator at the Health Museum. It is my pleasure to welcome you to our Menninger Health Series webinar. Today's discussion, titled Repairing Rifts and Ruptures in the Family, offers family skills and insight on restoring relationships. We are pleased to be joined by licensed professional counselor supervisor, Angela Koreth, who works as the program director of Menninger's partial hospital and intensive outpatient programs. Ms. Koreth's specialties include premarital and marital counseling, parenting and family counseling, dialectical behavioral therapy, emotion regulation, severe shyness, and codependency. Please join me in welcoming Ms. Angela Koreth.
Thank you so much, Paige. I'm excited to be here. Ruptures without repair lead to a deepening sense of disconnection between parent and child. And a prolonged disconnection can create shame, humiliation, and it's what we call toxic in the child's growing sense of self. But timely repairs by the parent with their child after the rupture is a new level of alignment where both child and parent actually feel understood and connected. And the child learns, hopefully, the fact that reconnection and healing is actually possible when ruptures happen. Before we get into the nitty-gritty of our talk or presentation, I just want to spend a few minutes talking about some foundational things that healthy parent-child relationships need. One of that is called attachment styles. Attachment really refers to the fact that this is what our children are getting from us. They get it from the moment that we learn that we're having a baby, right? There's that emotional bond that starts connecting. And when they're born, they communicate that through their excitements, their cries, their woes. Our job, parents, are trying to figure out and solve what is going on with them. And through that communication and that ambiguity and uncertainty, we figure out how to securely attach to them. We know that if children are securely attached and we are humans, we're going to make mistakes. And in these moments, this is a very normal part of child and human parent-child relationships. Instead of trying to be perfect parents to our children and creating perfect spaces in this parenting, through these mistakes, we actually help them develop in a healthy sense, because we know there are going to be ruptures that happen in their world outside of our home, with their peers, with their teachers, with their coaches. So the focus is this last tab is really parents, our job is to try to create a secure attachment with our children. This is where we can regulate our emotions, that we create a compassionate environment for our children. And this is where we can empathize their experiences and let them express their feelings. The second thing I want to talk about is attunement. So what's attunement? Attunement is our ability to be aware and respond to our children's needs. It is deeply connected to the emotional attachment. Some children may have very different temperament than the parent, or may not communicate affection the same way we do, which actually interferes with the quality of that emotional relationship. But if we can be caretakers that are emotionally in tune with our youngsters, we actually can do a really good job of helping them start develop in an emotional well-being. So if they're excited, parents, how can we stay excited? If they're irritated, how can we get down to their level and understand that? And all of that, if parents were in tune, is we need to figure out how to regulate our emotions. Some emotionally attuned parents look like they can tune into their children. You're able to give them undivided attention. We can practice empathetic listening. We can give them space and understand their perspective. We help them be aware of our emotions. The bottom line for attunement is it's an important factor in the rupture and repair cycle. So let's talk a little bit about stats. Dr. Ed Cronick did a study. If you took Psychology 101 or any kind of parenting, you probably saw this video. If you haven't, you might want to check it out. He did a stealth-based experiment, which took into account how infants and caretakers are attuned with each other. And they found that surprisingly, it's a small percentage. Even in healthy, securely attached relationships, caregivers and babies are only synced 30% of the time. The other 70%, they're mismatched. They're out of sync, making repairs and coming back together important. The study showed that babies worked really hard. If you look at the little diagram, worked really hard to try to repair, reconnect with their parent. So again, Tronick says that it is really important in a child's well-being that they learn to self-regulate, coping, and resilience, and they get this through the attunement with us. So there will be small exposures, hopefully, as we're raising our children or teenagers, that in these missteps, we take the opportunity to help them deal and tolerate with unpleasant feelings for them and for us, tolerate them, and be able to work through some repairs. So ruptures, what are they? Ruptures are inevitable, even in, like we said, the healthiest relationships. And they give us an opportunity to help our children grow in a healthy way, especially if they're short-lived. So keep in mind, missteps, mistakes, misattunement, ruptures will happen. We need to really, parents expect they're going to happen. In any relationship, there are going to be conflicts. There are going to be uncomfortabilities. A rupture can also occur through what we don't do. We say we're going to do, actively choose not to share something that our children think they want, that's important to them. Children will have conflicts with us, their parents, their peers, their extended family, their siblings, teachers, coaches, classmates. So they're going to have these relationships, and for them to be able to practice these missteps that might happen in our homes, we'll give them practice to be able to handle those things outside of our home better. Humans need relationships. Learning how to weave relationships and how to make those relationships with others work is sustainable, especially when ruptures happen. It is significant in determining the factor of quality of life and well-being. We don't want our children to avoid these situations. So there are a few different kind of disconnections and ruptures. There's oscillating disconnection. Both parent and child have different needs for the connection and solitude. Benign rupture, understanding, in which parents doesn't get the message being set by the child. Limit setting, resulting from limits which parents have to set and teach appropriate behaviors. And toxic rupture. Parent loses control of his or her emotion, and parent behavior is frightening to the child. So I want to just focus a little bit about the one that I'm going to talk about is toxic rupture. This is a term that Siegel and Hatzlow give the disconnection and the term is because of the disconnection interaction between the emotionally reactive parent creates when they lose control. It is when we take the low road of impulsive, repetitive responses, which there is a lack of self-reflection and empathy for the child's point of view. An example of this is when we yell, we threaten, use statements like you always, you never, or name calling. This overreactivity is usually connected to our own childhood, and we can hear probably ourselves saying the things that we were told as children and promised never to do when we became parents. What are some other examples of ruptures? Not understanding what the child is saying and failing to check in if we have a correct understanding. We miss the significance of something the child is saying, why and how it matters to them. By not responding to something important for the child in an empathetic manner. not holding in mind what might be important to them, and end up being insensitive in how we approach the issue. Not validating the child's feelings when they share something sensitive with us, betraying their trust, sharing sensitive information they've entrusted with us, breaching an agreement we've had with them, making unilateral decision that clearly shows we're not taking their needs into account, making decisions about something we want to do and ignoring what might be in their best interest. Push too strongly for our points of view and what we might think is right, and not allowing them to speak for themselves, look at their views, and look at from their viewpoint. So repairs. Repairing ruptures is essential in parenting. When the relationship is positive and there is trust and a belief in the other is good. Repairing ruptures as soon as we become aware of it is vital. We don't want repairs lingering for a very long time. If relationships are critical, yet interpersonal conflict is unavoidable and even necessary, then the only way we can maintain important relationships is get better at resyncing ourselves, especially when we know that ruptures are going to happen and repairs are needed. Parents, repairs look like us being empathetic, warm, loving, accepting, curious, and playful. I want us to leave this conversation today knowing that there are going to be conflicts or misalignments. I want that to be a part of our expectation. It's how we are going to work through them that will matter. The love is actually in the repair. A bid for repair is one of the sweetest, most vulnerable, and important kinds of communication a human can offer the other. It says you value the relationship. The rupture in the connection occurs, which they will. It is equally important that caregivers work to repair the rupture and restore the emotional connection that feels safe and soothing to the child. This is that secure attachment I was talking about. This is about being attuned with our child. This is what we will see in healthy relationships with them. So this is just a kind of a slide to make sense of what is rupture, what is repair, and what we want to strive for is attunement, connection, and repair. When children feel calm and connected, we increase its chances they will become happy, curious, affectionate, and self-confident. This is what we want parents for our children. When children feel calm and connected to parents, it builds inner security, enabling more positive connections with others. If they feel a secure relationship with us, they will practice those things with their peers and in future relationships. Parent-child relationships are strengthened through horizontal power dynamics like playing together, negotiating, sharing, collaborating, taking turns, compromising, having fun, and sharing physiological, psychological intimacy. Parents repaired missteps and restored intimacy by expressing this through warmth and affection. Talking about what happened is meaningful to our children. The apology and amends that come with it is vital. Ways to decrease these ruptures for parents. Here are some things that you might need to work on. Do your own work. Figure out what's causing you to flip your lid. Track the triggers. Is there anger, guilt, unresolved issues from our childhood, parental shame, parental avoidance, the desire to just move on and not just talk about it. Develop a fierce practice of self-compassion and grace. Find your village, parents. Who are other parents that you can lean on, that love you, support you, that are safe, that you can talk to, that you had a misstep with your child, that will compassionately remind you, yes, it's okay to have boundaries, and let's make sure that you're accountable and living in line in your parental duties to your child in line with the values that you want. Look for patterns. Do you get dysregulated when you're anxious, stressed, tired, hungry, fighting with your spouse? Am I living in line with my parental values, the values that we set forth, what kind of parents we want to be? Are we honest? Are we kind? Are we loving? When we have these ruptures and repairs, are our behaviors in line with those parental values? So building healthy parent-child relationship. This is the second half of this presentation. Ultimately, this is what we want in our relationship with our children as we're raising them and as they become adults. We want these pillars in our relationships with our children. Securely attached children have a sense of well-being and safety with their relationship with their parent. Safety is at the core of bonding and self-regulation for them. We want our children to feel secure, safe, loved, know that they will be able to manage whatever feelings that they have with confidence, that they will know what is a healthy relationship and what it should look like, because we're role modeling that for them, that they can approach the world with openness and enthusiasm, that they can seek healthy relationships with friends, even future partners, and possibly their own children one day. So healthy communication is important when we're making repairs. Communication that can actually continue rupturing the relationship, or it can help repair it. Assertiveness is what I want us parents to focus on. It's the healthiest style of communication. Assertiveness requires us to recognize and stand up for our own rights, while we also consider respecting the rights of others. These mistakes or missteps can cause ruptures. Left unaddressed, unrepaired, these ruptures have the power to change the culture and existence between the parent and the child. They can set a tone for escalating relationship conflict. It can change the course of a relationship and even potential breakdown of that. The best communication style we parents want to strive to be is assertive. And this is the one that we want to teach our children. The basic concept, it leaves both of us worthy. Our body language is open, firm, and warm, respectful in tone, relaxed. The language style becomes communicated as confident, calm, polite. It leaves us with positive regard for the other. There's a feeling of fairness and our needs are met. So this is something as a clinician I love talking about and teaching to my parents. It's responding versus reacting. Siegel and Hartzell in their book, Parenting from the Inside Out, states this kind of beautifully. A deeper sense can help you raise children who thrive. If we repeatedly react rather than reflect and respond during these moments of frustration, we are apt to creating communication breakdown and power struggles. We can be much more effective parents when we remain collaborative with our teenagers by staying engaged during difficult conversations. Becoming aware of our own emotional reactivity or hot buttons can help us know how to remain calm. Then we prevent relational ruptures. So I always tell our parents, as your kids grow up, they're going to mess up. Expect that. It's what are you going to do when they do? How are you going to react? How are you going to respond in a healthy way? Repair to a parent-child relationship can only happen when we take some time to reflect after the incident. With reflection, we can strive to take the high road. That's what Michelle Obama talks about as high road, which involves being emotionally calm, centered, rational, reflective, and flexible. This is especially true for parents of teenagers. With our greater emotional maturity, we can take the initiative to repair the rupture. With thoughtfulness, we are able to focus on both our own experiences as well as our child's. I love this art piece. In the Japanese tradition, broken pots and vases are artfully mended together. And these gold strands emphasize the importance of art. It's beautiful. People are so scared of, rupturing a relationship and even avoid trying to do the repair, but there's so much beauty in it. So kind of keep this in your mind frame. I tell parents, remember that gold, remember the gold strands that will happen. The strands of emotional gold in parent-child relationship consist of self-acceptance, patience, humility, courage, and a lot of tenderness. And these things happen when we have meaningful apologies, which can help us have restorativeness in delivering something that's heartfelt. The ability to let go, hold on to something that prolongs this pain rather than learning from it. And the opportunity to grow. This is what we want to teach our children after a repair. So apologies. This can be tricky for adults. Apologizing to your child might feel like it's beneath us, or we may fear that we're giving away our power somehow. We shouldn't have to apologize to our kids, is something I hear constantly in my therapy office, because we're the adults. Well, are we always right? Probably not. We want to think that, but we're probably not. So it's most important. One of the most important rules in relationship is to apologize if we're wrong, which also applies to our children, but also to us, the parents. We need to say sorry, loud, clear, especially when we goof up. The truth is that it actually sets us free and our children from being in a cycle or a stuck loop. A child is naturally forgiving of their parents' misstep if they feel like the apology is genuine, if the mistake was not intentional. Be aware of not repeating the same behaviors. If we truly apologize and say sorry, we want that behavior to stop. We want to learn from it, and the kids want to see something different happening. Otherwise, trust will be broken. So this is something that I really hone in on: amends versus apologies during ruptures and repair cycles. There's a huge difference between making amends with someone and merely giving them an apology. While a sincere apology is really crucial in making amends, an apology alone is simply not enough to undo the irreversible pain and heartache that one's actions may have caused. Whenever we consciously understand that we've hurt somebody, it cuts to the core. Taking action to amend that certainly helps the hurt person, as well as you who might have caused that, heal, the parent. We're not bad people. We're simply human beings learning to make better choices. We teach through these role modeling that they can initiate a repair sometime in their future, and that they know the most important thing, that we're there for them and we value this parent-child relationship, that we respect them enough to apologize and make amends, that things will be different. So there are some steps to apologies. And I try to give this example in the office. In my therapy office, we usually have lamps, and I have parents and children sitting on a couch similar to this. And I always give this example. Hey, mom, if I came over and I wanted to switch out that light bulb or turn it on because it was too dark in my office, and I stepped on your toe, what would you feel? She would say, I would feel hurt. I would feel angry. I would feel confused. My intention was to lighten up the room, right? My intention was not to hurt you, but I did. So I need to apologize. Mom, I'm sorry for stepping on your toes. I've caused you hurt, pain, confusion. My intention was actually to turn on the light, but regardless of my intention, I caused you harm. I want to apologize for that. I am sorry for hurting your feet, your feelings. Will you forgive me? And mom has a chance to think about it and say, oh, therapist, you're not a mean person. I think you really hear how I felt, or what it felt like for me. It's not just about just a simple apology. You really truly hear what went wrong, what the feeling was. And before she can accept my apology, I need to make an amends, which is, Mom, next time I need to turn on the lamp, I'm going to say, Susie, I need to turn on the lamp. I don't want to step on your toes. Could you move your feet? Right? I can be more communicative. So, Mom, will you forgive me in that scenario? So I teach parents and children in that scenario, even things like a light bulb, turning on a light bulb, we can cause people harm. And in the apology, we want to acknowledge what went wrong, what the feelings were for the hurt person, how we made them feel, and acknowledging, validating that feeling, and expressing that we are willing and wanting to do something different in the future. What am I sorry for? This is wrong because next time I will. Is there anything else I can do to fix this? Will you forgive me? These are the statements that should be coming along with an apology. In healthy communication, this can be written or verbal. And I want us to realize, not verbal, it's nonverbal. It can be in our body language, in our tone, in our posture, in our gesture, and if we're looking away from them, right? It's all important to keep in mind. So we want to be in tune with each other when we talk to our children. So how do we create I statements? How do we be clear and avoid ambiguity? How do we be mindful of that body and body language? No swearing, no criticism. Remember to respond. How are we going to respond versus react in these situations when we want to communicate? Consider the time and place. Sometimes parents like doing this in the car. I'd say do it when you're going on a walk, because you don't want the kid to feel trapped or while they're playing video games. How do we have soft startups? I always say, I love you so much. I want to have this discussion. This has been on my mind and you are really important. I want to have this conversation with you. How do we diffuse that by saying, I'm coming from a place of love. I don't even know what I need to say, or I don't even have the words, but I know this is an important dialogue I want to have with you. How do we be in a state of collaborative problem solving? Have compromising as a mindset, not as a weakness. We want our children to feel like we're collaborative with them. Pausing, reset. I always say, if I'm not going to live or say something in line with my values, I want to pause. I want to reset and make sure what I do say and what I want to say is in line with that. Remember, apologies without amends are good, but apologies with amends are great. And they really help in the safety and security and trust building with your child. Timeouts and follow-ups. Sometimes conversations get heated. We're not in line. Neither one of us are in line with our values. How do we say, sometimes it's okay to say timeout. I want to raise a white flag for a minute. Hey, I need to go get a glass of water. I'd like to get you things, a glass of water, so that I can calmly share with you what I want to share with you. After we have these moments, we can also follow up. We might not get everything resolved in that moment. Our kids might say, okay, fine, I accept. But do they really? We might want to follow up with them. How do I, in 2 or 3 days, say, hey, I just want to make sure things are okay. I want to make sure you felt like I heard you. Follow-ups are really, really important. They're meaningful to children that you care. I don't want you following up 20 times, because then they might say you're harping on it. Let it go. The importance of effective communication. We want them to grow up as happy, healthy, functional, and learn these skills for their futures. Our children are seeking our approval and guidance and support. How we communicate with our children is likely to be role modeled with others in their future. Children learn values from our actions, our works, our tones, our body language. What are the messages that we give off to them about who they are, their beliefs, their values? Communication skills and strategies are important as they learn how to problem solve in a positive and healthy way. So rupture and repair, again, is a part of any relationship, and it strengthens the connection between people. And for parent and children, this is very vital and important. So a lot of times parents say, I don't have the words. So I've come up with a few kind of things to think about that feel free to take away or use or figure out how to customize it to your family. I'm sorry for yelling. I was angry. Next time I will try to take some deep breaths when I'm upset. I am so sorry that I got so frustrated with you. You do not deserve that. I know we were both just confused. I am sorry. I did not stay calmer. I'm sorry I caused you pain with my words. My response is my responsibility, and it's not okay for me to talk to you in a disrespectful way. Will you please forgive me? And so on. Again, I think in life, it takes time to correct our ruptures. So being thoughtful and reflective before we go into these conversations with our children are important. But even after the fact, if we don't know how to appropriately repair, it might take us a minute. Let me think about that. And I want to really think about what I want to say. And then be able to articulate your apologies and repair attempts. Repairing and healing, right? Sometimes we get into battles with some of our kids and parents because they forget what the priority is. It is really about this ability for parents and children to navigate the space with forgiveness, which will leave them with a deepened closeness and connection. This is what we want. That's the priority here. It's not to prove if we were right or wrong, or is it to restore connection? So I'll ask parents this: are we here to prove each other right or wrong? Are we here to restore stability, safety, and connection? To heal this or pay them out for what they feel that each other did? Is this like a threat? Are we here to repair and heal the relationship? Are we here to shame people? Is this to bring us closer to each other or push each other away from each other? So I think there are these challenging questions that we need to consider, and it really refocuses us in line with what kind of parents we want to be with our children. It's okay if you feel, parents, you're getting it wrong. It's okay. Really is. We are going to get it wrong. I want to give you the power that there is a lot of power in repairing after the rupture, which is where we can reconnect with our children and which can build lots of safety and security for them. This is not only important for them, but really important for us. Try to remember that we're doing the best for our children, and they're actually doing the best that they can. Compassion goes a long way on both sides of the fence. The child learns to trust, even though it's an imperfect world, his or her parents are there for them. This is so vitally important for our children that we work with. Our mental wellness is based on knowing that we are safe and supported. With a realistic view that the world is imperfect and that we parents are human and can make mistakes, there's a lot of compassion. And we're teaching them to have more acceptance of people as they are in this world. Taking the position gives us the ability to give them grace as well as ask that from them to us. So as I end and wrap this up, just a few things that I want you guys to think about. Experiment with seeing rupture through the eyes of your children. What part of rupture can you, what part of rupture can you genuinely take ownership and accountability for? on your side, are you able to, in small sizes, not in a big list that's overwhelming, talk about what went wrong and how to repair it? If you allow yourself to consider how significant this relationship, the priority, how might you repair this rupture? Which are you closer to? Are you willing to move towards each other and the care of the relationship, or are you hell-bent on being right? Some resources and questions.
Well, thank you, Ms. Koreth, for your wonderful presentation. And thank you everyone for joining us today. There are a few questions that I see that have come through, so we'll get started on those. But just as a reminder, if there are any additional questions that come to mind, you're welcome to enter them in the Q&A section of your screen, and we'll be checking for the raise hand symbol as well. So the first question that came through was, do you have suggestions for a practice of self-compassion and how to let go of guilt?
So I think there's a lot of books out there about self-compassion. I think really recognizing that we're human, and that mistakes are a part of our DNA. There's no perfect person. And that we really do strive to do our best and really try to do that. But I think if we do some value-centered work, if you type in value-centered, really knowing what your values are, and leaning into that, and what you say or what you do or in the relationships, that's a great place to practice self-compassion, because I hope on everybody's value list is forgiveness. And so when we're not acting or saying or we missed up, that we could practice that ourselves. And there's a Kristen Neff, Neff, I believe, yeah, has a book about self-compassion that's really, really good.
Okay, well, thank you for that. They also asked, can you please repeat a couple of soft startups?
So soft startups with my kiddos might be, hey, mommy wants to have this conversation. I'm nervous. I want you to bear with me through this. I want to have this conversation because I love you and you're important to me. This is something that makes me I feel like I don't have the right words, but I know I want to talk about something with you because you're so important to me. I always say soft start is like the preface before you lead in. So what's happening to the kiddo when you're saying, they're like, and they're like, oh, okay, she's not going to yell at me and, rip my head off, right? Like there's this diffusing that happens in those soft startups.
Great. Someone asked what to do if an adult child abruptly ends a relationship completely and blocks all communication.
That's hard. I think how we might repair that. I think sometimes it might take time, right? So we might talk with, if that's happened, we want to be reflective. Why might that have happened, right? And it could be through a letter, through an email, through a text message, right? How do we let them know when they are ready? We are wanting to have that conversation. I don't know if there was a rupture that created that, right? But I think sometimes we do have to, especially with adult children, hold space for it might need to be on their time. I would tell parents, while we're waiting on their time, how do you prepare for that, right? What is the work that you can do? Is there an apology? Do I need to be curious about what I did or didn't do that caused that rupture? And then be prepared when they're ready to do it. When you're ready to have the conversation, I am willing to have it when and where you're wanting to do that.
Awesome. Heather is asking for a resource for a rift between teenage siblings.
On the top of my head, I don't know. We've done a lot of family therapy where this might get played out, and with a therapist help, they might be able to navigate that. Sometimes we just do sibling therapy without mom and dad, which kids are like petrified, but usually what they figure out is, whoa, we both need to take a accountability. Oh, let's figure out how to make amends, and having these conversations about how do we apologize. And I think it's a family conversation, right? What's apologies to you? Understanding what each of those sibling understands about hurts and repairs and ruptures, and then how they might want to move forward. Some of that is normal. But if I do, I might give you some resources. Maybe I can send it to you, Paige, some books.
Okay. Yeah, absolutely. And then we'll share that with you all via email. Okay. Linda's asking if you can briefly compare the 4 types of ruptures again.
Can you see that, Linda? I hope you can see that.
Mm-hmm. And I guess I had a question about the toxic rupture. So I guess with that, when is enough to say, look, this person continues to cause these ruptures in this way, it's more healthy for me to walk away than to give it that chance again?
Sure, that's that repeat. Like if we continue and the behavior doesn't change, even though I'm hearing and I'm sorry, or I won't do it again, and it really does. I didn't get to, in the time constraint that I had, to talk about boundaries, which might be another topic that the Health Museum, but healthy boundaries, right? When it isn't serving us, right? Because we don't want to enable bad behavior or being abused or neglected in any way. That's when we need to say, no, I'm not doing that. This relationship I've given, and we can make peace with that. I've been forgiving. I've been, willing and compromising. And I love myself enough to say, this is not healthy for me and I need to walk away. Until you can make maybe amends. Maybe you can apologize and really stick to the amends. And if you can't do that, we have a right, children have a right to say, I don't trust you.
Yes, I remember you saying that the apology is good, but the apology with the amends is great. So.
Yeah, and that's really about like unhealthy codependency, boundary setting, which is also all of the stuff that's important in healthy relationships.
Awesome. We have 2 questions about going back to the resource slide. If you could share that again on the screen. Sure. And while you're looking, there was a question about how does age and maturity play into whether a child can understand accountability?
I mean, again, child development, their brain is small, right? When they're little, they're still formulating. There's a lot of research on brain development, and a full brain. When I do parenting presentations, I show them the brain, and I say that brains are fully formed till about their mid-20s, 25 for women or females and 27 for males. So what does that mean, parents? Our kids are going to make mistakes. Our kids can only do things and understand things. Again, I want to say like bumpers, right? It's limited. So I think, with toddlers and as they grow, it's going to get better. They're going to be able to expand on their learning and their maturity. But when they're small, we have to expect that it's going to take some time. But there is some accountability. If you punch your brother's going to feel hurt because he's crying. Would you, you can help them understand that, like no hands on, your sibling. So there is ways to, I want to say, get to their level, help them understand so they can understand from their level.
Yeah, great question and great answer. I had a question, kind of this phrase that goes like, oh, I'm breaking family curses. And that mindset, what do you think about that phrase in general? And is that a healthy or harmful outlook to have? Like, does it place too much responsibility on one person to mend these familial problems? Or do you think this is a good outlook to have just because it's like more of a positive, open mindset going into?
Say the statement again. I didn't hear the first part.
Breaking family curses, kind of air quotes of breaking family curses.
I think there's a lot of people at the seat of the table, right? Sometimes it's really interesting because there's family roles. There's another conversation about is that always your responsibility, right? Sometimes in cultures, it's like, oh, you're the woman, you need to solve the problem, right?
Mhm.
Or you're the man or the oldest in the family, you are the head of the family, you need to solve it, right? So I think sometimes that feels like pressure instead of saying, wait, family is just not me. It's not just an I, it's all of us, right?
Mhm.
We can be willing, but we can't make others come to the water, right? Like if we're willing and others are willing, we can make progress together. Just like in parent-child relationship, you can't fix it if there's not different parties willing to also fix it.
Yeah.
I also think when we're trying to fix it or problem solve or help those situations, we got to really think about the history, right? Like some of this
Mhm.
stuff is generational, cultural components play a part to that. But I think if we have willing and we really think people's intentions are good, right?
Mhm.
We can make some movement in healthy ways to repair things.
Awesome. And to answer your question, Kim, yes, we'll be sharing the YouTube link and email for all the attendees. And then we'll also have it on our YouTube channel, and Menninger will also have it on their channel as well. And I guess my final question would be, how does spirituality affect family relationships? I know we're in the South, and so we're, deeply religious down here. Do you feel like the stronger spiritual ties make those relationships easier, or do they make them more difficult when they're, being leaned on more or less heavily?
I think it really depends on the person and how spirituality plays a role in it. I've
Mhm.
seen a lot of times spirituality being very positive, right? In line with, God wants us to be forgiving. And so I want to be a forgiving person. So I'm going to practice the forgiveness. I've seen it go left because you could forgive too much and get walked all over, right? And so I also see, there being conflicts within spirituality. They make people feel like I'm a bad daughter or bad girl, that my father's hurt me or my brothers,
Mhm.
caused pain to me. But I need to stuff those away. So I really think it really needs to come from a place of wellness, even if we're prioritizing our spiritual connection. And there
Mhm.
could be positives and negatives. I think it really goes back to how do we conceptualize it. And I think anything that helps us heal, anything that creates positive ways to repair ruptures that is in line with wellness and well-being, I think is good. But I think I want to make sure it's not avoiding or hurting you even more.
Right. Okay, great. Well, thank you, Miss Koreth, for joining us. This has been such an informative conversation, and thank you for sharing your expertise. The Health Museum is offering more of these talk series with Menninger. The next session is March 30th, entitled Helping Kids with Loss and Grief. And we'll be joined by licensed clinical professional counselor Brenda Taylor, and this discussion will entail assisting children in healthy expression of emotions, where she will share ways that you can help your kids through these experiences. So thank you, Ms. Koreth. If you don't mind just staying on for a moment after everyone exits. Thank you for your time today, and thank you everyone for joining us, and have a wonderful day.
Thank you, everyone.